caution is the watchword, and of course keeping to the measures put in place to keep us safe from this virus. I'll be talking this morning by phone with Dr. Oyefabi Adigboyega Moses. He is a consultant public health physician with Barao Dikko Teaching Hospital, Kaduna, and a senior lecturer with Kaduna State University. Dr. Oyefabi, good morning and glad to have you on the show.
Good morning, Mr. Tony Alabi. Thanks for having me on this show this morning.
All right, I was just giving a picture there, a background there about what is happening all over, and of course back home in Nigeria, we are on the increase again with the coronavirus. So it is not gone, but now that we're all about up and doing with our business, schools have reopened, markets have reopened, and all the forms of businesses are all up in doing. How safe can we still say that we are with the coronavirus?
Thank you very much, Mr. Tony Alabi. We just need to thank God for how far He has helped us in this country so far. Just as you have rightly said, you started by giving the global picture. As at today or yesterday, we have about 37 million cases globally. And just as you have rightly said, US is still leading by close to 8 million cases now in the United States of America. Back at home here, we have recorded 60,430 cases in Nigeria so far, and Kaduna we have 2,508 cases. Now the good news is that the curve is flattening. As such, yesterday in Kaduna, we have just 12 patients on admission. Although there have been so many postulations that we are not testing enough, but if you remember some few months ago, even with our testing capacity, we were still having a very high number of cases, but the cases are dropping. But the message this morning is that we should not let down our guard. This is the message I'm bringing this morning. We should not let down our guard. You can see that the big countries in the world are having all manner of issues, and the world is a global village. So the message this morning, very clearly, is that we should still know, just as you have rightly said, that the virus is still very much around. And very recently, we begin to see the severe cases of coronavirus, even in Kaduna State. Last month, we have some few cases that were very severe, and they kept us on our toes for close to about 2 weeks. And I can assure you that if you have just one case of coronavirus, it might be more than having 100 patients on admission, because of the enormosity of the requirement to manage such a patient. So our people should not say coronavirus is off, let us be doing the way we like. We should still keep on to those protocols. Just very simple protocols. These things are very simple, but they are very, very effective. And we are talking here of making sure that you use your face mask appropriately, keep to cough etiquette, make sure that you observe social distancing, at least 1 meter from the next person, avoid crowded places, proper disposal of waste, personal hygiene, and other protocols. Schools are now, we are about to start talking about school reopening. So school authorities have to make sure that they put in order the NCDC guideline for the opening of schools. And this will also include all these protocols I've mentioned, including bringing about innovative ways to making sure that students are safe. Now, schools can use the internet platform to hold some classes. Some schools can say, okay, now since our numbers are many, you come in the morning, this group come in the afternoon, so that our children are safe. So the message is clear. The virus is not over, and our people should not lay down their guard. Thank you very much.
Yeah, Dr. Fabi, something is coming out here, and that's back home with us in Nigeria, and of course in Kaduna State. We are not reporting, and we are not testing enough. That's been made very clear. We're still burying our dead. Marriage ceremonies are still taking place all over the place, and so we do not have data to show just where we are with the coronavirus. Now with that kind of situation, what would you say could be the serious problem or challenge that we may face in future?
You see, the issue there. Thank you very much for that question. Yes, it's good for us to test more, It's good for us to do what we call active surveillance, going to the community to do surveillance and possibly target screening of people. Now, this is very good. Let as many people as possible be tested, but let us still make it clear that our positivity rate in this country as of today is about 20%. What does it mean? If you test out of 100 people that were tested, 20 those who are positive, about 100 in 20 in 100. Now, what we are trying to say here is that the issue of testing, though it's important, but the few tests that we are doing, we begin to see that there is a drop. And if you look at the population, you find out that even in the general population, we have not started hearing of mysterious reporting of deaths from any of our locality. Again, the number of people that we observe who are becoming sick of the virus is coming down. And again, there's also what they call the principle of community herd immunity, or what we in public health call herd immunity, as in saying that there may be possibility of some people developing immunity against the virus. Are you getting my point?
I'm following.
Now, all these are there. All these are there. So either we are why is good for us to test more, but for the few tests that we have carried out, you remember that we are in developing nation. We may not be able to commit all our resources to testing, although government is also making effort to making sure that the testing capacity is increased. Like in Kaduna State now, we are opening more centers for testing. Now there are centers in Yusuf Danso where people can go for testing. There are centers in other general hospital like Sabo, like Baradiko Teaching Hospital, where people can go and do testing on their own and have their results. So government is looking at possibility of increasing the capacity of testing. But you should know that we are in developing country. We may not be able to commit all our resources to testing for COVID. Are you getting the point? But what we are saying is that for the few that we are testing, this is the results that we are observing. And observing the general population, people are not becoming sick in a mass that demand a public health action. So we can still hold on to that. But the most important thing, Mr. Tony Alabi, is that let us keep on to this preventive protocol. The preventive protocol is better, far better than testing. Testing is a secondary level of prevention in public health. That's the second level of screening. The first level is all these things that we're talking about hand hygiene, face masking, social distancing, personal hygiene. These are primary prevention approach that and they are very cheap. And this is all about primary health care delivery services. If we keep to all this, I can tell you the virus will no longer become a disease of public health importance. So the most important thing, as far as I'm concerned, is this prevention, not even the testing.
Okay, doctor, have we gotten over stigmatization and discrimination in having people come out for tests? Like we have when we have such ailments as malaria. Have we gotten over stigmatization and discrimination to have people come out for testing?
Yes, we have made tremendous progress concerning the issue of stigma. You can remember that in Kaduna State, we began to do taking testimony from those who were positive for COVID. Even in the country, several people are coming out to give testimony of their experiences. Both high and low profile people, they are coming out to say, look, these are my experiences. This is how I passed through it when I had this virus infection. So people are beginning to see that from different kind of public action, including risk communication, people are beginning to see that, look, this is not this virus is not it should not be a stigmatizable kind of thing. It's not that the person has committed a sin or maybe something is due to an evil that somebody had done. So people are beginning to see that, look, this should not be stigmatized. Although we still have cases. You remember at the beginning of the pandemic in our state here, we have cases of people that were positive, and some people were even going to their houses and throwing stone or trying to give that person all manner of trouble in the locality. But those kind of reports are coming down. So we can begin to say, we begin to get some positive results as per people not being discriminated because they have the coronavirus. So the main challenge now is not about stigma. The main challenge is about compliance to the protocol for prevention of COVID-19. Thank you.
Is one protocol above the other? I'm asking this question because even world over, we see that face masking is taking, the high on the measures. But again, back home, would you say that one, protocol measure is above the other?
No, there's nothing like one protocol being above the other. They see, if we are going to take one preventive approach that some public health authority have described as the vaccine for the COVID-19, is the appropriate use of the face mask. This is critical, and that was why WHO declared about a month ago. They declared a day, a whole week, as a face masking week. You know that we are talking of a droplet infection here. Are you getting the point?
Yeah.
And one crucial way of preventing this infection is to make sure that you have a face mask. Not only having it, you use it appropriately. And once you know that the face mask is already contaminated, you appropriately discard the face mask and take another one, especially when you are in the public places where you have 3, 4, 5, 6 people gathering. There's a need to put a face mask. If you are alone, good and all right. So out of all these different preventive strategy, a very, very critical component is the appropriate use of face mask. But it cannot be a standalone. And that was why the issue of the hand washing is also is critical and is very good. And you can know hand washing is not only going to prevent you against coronavirus, it will also prevent other communicable diseases that have to do with fecal-oral route of transmission. So they are all important.
Yeah, doctor, let me tie this with what just happened recently. We know that our schools, will be, reopen in a short while. We also know that it's only ASU that's keeping our, high institutions from, getting opened. And of course, we also saw the end SARS protest that we saw, and all of that called for serious concern about schools reopening, where we have, the vibrant and young ones amongst us who would let go of all protocols when it comes to, staying safe. Now, how safe again can we be when you talk about schools reopening and having our schools coming back home, and looking at it that the schools we have around us do not measure up to the standards of the United Nations, standard qualities of having, pupils in classrooms and all of that?
Yes, thank you very much. That's why in Kaduna State, our government are not in a hurry. They want to ensure that things are put in place before the schools are reopened. And I can assure you, the State Ministry of Education, they are working seriously with the Ministry of Health to bring about a team that will be supervisory and will oversee what happens when our schools are reopened. And just as I've said when I started the discussion, one crucial component of school reopening is to get the what they call the consent or the assurance, from the school authorities that they are going to keep to the protocol. And the parent teacher association of each of those schools now become a critical stakeholder. Each schools, if you look at the national guideline for NCDC, each school is going to be mandated to have a kind of an infection prevention committee that will be watching what happened in that school every day and reporting to the appropriate authority in the local government and in the state. Then each school will be mandated to have a place, either a school clinic or a holding bay, that if anybody becomes sick, the person can be taken to an isolated place, and the person can now, if the person is a suspected case of COVID-19, the person can be held in that place until the appropriate local government, the state surveillance notification officer is notified. And if it's on COVID, the person can be appropriately managed or referred to the appropriate places. So there are going to be a lot of discussions with schools about putting all these protocols of hand washing in places, social distancing protocol in places, issues of a holding bay or a clinic will be in place, and there will be a committee in each of these schools that will be reporting what's happening in the school to the stakeholders. And schools are also going to be given be instructed to making sure they have innovative way in places. Some lectures or some classes may not have to hold. People can do virtual classes in some instances. So all these things are going to be monitored, both at local government level and at the state level. The State Ministry of Health, in collaboration with the State Ministry of Education, are going to oversee this. So we are hoping that as much as possible, things will be done appropriately in most of the places. The challenges might be from the rural schools, but again, we have local government authority that we are trusting that they will help us to oversee what's happening in those places. Thank you.
When we saw during the palliatives, government was seriously involved in the palliatives. Again, are we saying that added responsibility will come on government even as we get ready to have our schools opened? I mean, I'm talking in terms of even providing the face mask and having the sanitary pads and all of that in place. Yeah. Would you see it as an added responsibility on government, especially, as you've said, our schools back in the hinterland would provide for all of these? Then we talk about private schools who are also in a hurry to have, their schools reopened.
Yes, government will definitely make provision for the public schools, and the private school authority will be mandated to make sure that some of those things that you are talking about, the personal protective equipment, are in places. So it's not, and in the private schools, I have told you, there's also going to be a kind of a collaboration between the parents and the teachers via the parent-teacher association of each of those schools. They're going to have a committee that will decide how each of those private schools will run their activities. So government is going to come out with all this, but you can be sure that government is going to provide support first for the public school, and possibly for private school. You get the point? But we may not know how much support government will give private school. But you can know either you are in public school or in private school, you still belong to the state, and the state has a responsibility for everybody.
So what exactly do we mean, at this time where, of course, the measures, government have told us about measures that we must observe to stay safe and from COVID-19. We have had jingles, promos on radio, television, all of that has been done. Government has played a very significant part in making sure that it creates awareness. At this point that government is saying that we are on our own, what exactly do we mean here?
When government says that we are on our own, what we are saying is that we should take personal responsibility. Everybody is a stakeholder. Parents at the family level are stakeholders. They should teach their children the basic facts, just as we are discussing here about COVID-19. The community leaders, the Mianguas, they are also stakeholders. They should cooperate with the local government authorities and the state government on all these preventive measures. And when we have reasons to go to a community for either for screening or for testing, we need the cooperation of the community leaders. So the market women leaders, the road traffic union people are all stakeholders in this business. So government is saying, excuse me, we have already giving all necessary support. We have set up a rapid response team. We, as much as possible, set up all the isolation centers, and we have made provisions for people to be informed about this disease. For prevention protocol, we have made provision for that. Even for those who are sick, we have made adequate provision for their treatments. So now there's a need for the populace to take responsibility. So if you go out now and you don't use your face mask or you don't observe social distancing, then you know that you are on your own. That's what the government is telling us. Thank you.
All right. Dr. Oyefabi is consultant public health physician with Barao Diko Teaching Hospital and also a senior lecturer with Kaduna State University. And we're talking about COVID-19 and what we must do to stay safe and how we must observe the protocols put in place. We'll be getting ready to go for a break now. This is a commercial break. So that's when we come back, we'll be getting ready to have the phone lines opened. But again, we must, give kudos to Kaduna State Ministry of Health, who are the ones, bringing this program to us this morning. All we are told to do is that let's play our own part in all of this so that we can stay safe. Just before we go on that break, Dr. Oyefabi, if you look around you, like some of us have done, transportation, the markets, the schools, all over the place where we think that we can see public gathering. Some people would say, that it's sad what is happening there. About the vaccine too, that the world is waiting for, it's not coming and people are worried. The American elections, just, getting ready again for the American elections, but the cure is not ready yet. The world is not safe yet. This is all we're getting from the threat of COVID-19. But in all of that, just put a word on what we must continue to do, especially reiterating or re-emphasizing on these safety measures.
Thank you. The vaccine is here. The vaccines are the preventive measures.
The cure for it.
Yes, appropriate use of face masking is the vaccine for now. So we encourage the populace to please let us use our face mask appropriately. When we come back, I'll give a testimony on the use of face mask. And the other protocol, the hand washing, the social distancing, stay at home when you don't have anything to do outside, as much as possible.
Stay at home.
Yeah, stay
that's
at home.
That's a tall order. Stay at home.
When you don't have any serious business to go outside. When you are going outside, make sure there is a serious need to go outside. Avoid overcrowded places. It is not a time that somebody is doing burial somewhere and you are rushing there, or there is one ceremony somewhere and you must be there. You must not be there at this time. Thank you very much.
That's the new normal, right?
Yeah, these are the new normals.
Okay. All right. We'll go for a commercial break now and we'll be back with you shortly. Welcome back. Here's the program Perspectives this morning. It's coming to you on Invicta 98.9. And this program that you're listening to is coming to you courtesy of Kaduna State Ministry of Health. And our guest by phone this morning, Dr. Oyefabi Adegboyega Moses, a consultant public health physician with Barao Diko Teaching Hospital, Kaduna, and also a senior lecturer, Kaduna State University. We're talking about COVID-19 and, of course, staying safe and all we have to do to keep ourselves safe. Doctor, just before we get to the listener out there, there are also things that we must talk about here, and that's talking about this new normal. The new normal thing has exposed us to, it has exposed inadequacies, so to say, in the health sector. It has also, touched on the economic life of the people. It has affected life generally with us as a people. This may not be the end, and of course, what you would say in getting us even ready for unforeseen events, that may come again. How ready can we be for unforeseen events too?
For the unforeseen event that you have mentioned, we got to where we are now by the support of the state government. And we need to again thank the Kaduna State government for what they have done from March this year when this pandemic started. If you remember, we were in a Lassa fever epidemic, January, February. And as if to say, we just transited to start fighting COVID in March. And our government have been consistent. If you look at the report yesterday, only 15 states in the federation reported cases of COVID. You remember, and you can know that Kaduna has always been reporting. We have been very consistent, and the response we have been very consistent. We started by opening just with only one center, the center that we used for the Ebola pandemic and the Lassa fever epidemic, and this was later innovated, and we use for we're now using for the COVID-19. So from the one center now, we are now talking of 5 centers controlled by the state, and other centers that some other stakeholders are opening and are calling the state to manage. So, and just as I've said earlier, we have the response team, we have the pillars, there are 9 pillars that are responding to this epidemic. I've always been mentioning it. On top of that pillar is the case management pillar, where I am. We have the research pillar, we have the logistic pillar. So we have the infection pillar control people, we have a risk communication pillar. So we have a response team in the state. Now, now specifically to your question when you were asking that for unforeseen events, as far as the state is concerned, we have the structure in place. We pray that the cases are winning, the curve is flattening, and our prayer is that the curve will continue to flatten until there will be zero reporting of COVID in Nigeria in Kaduna State. But as far as unforeseen event is concerned, we are prepared. The state is prepared. We have our structures and we are ready.
Okay, let's get to hear from you, the testimonials that you said you were going to share with us.
Yes, what I wanted to say is that, you see, there was this discussion I was having with somebody recently, of somebody who was in a meeting, and this person is a professor in Zaria, was in a meeting, and in that meeting there are other people there, and everybody in that place were not using face mask. Only this professor put on his mask. Only him, he was the only person. Now, some few days later, there was a report that one of the people that attended that seminar or that meeting had become positive for COVID-19. Every other place, of course, they have been contact traced. Every other person was contact traced, and their sample taken and were tested. They were all positive, except for the professor. Are you getting the point?
Following.
So this is to emphasize the need that you can see why I say that the face mask is the vaccine for now. It looks very cheap, a face mask now just on the street about 200 naira. So imagine just a face mask of 200 naira being put properly in place and is highly protective and preventing somebody from getting COVID. And that's why we are saying, while we are waiting for the issue of of the vaccine, the vaccine that we are expecting, let the populace know that let us keep to the protocol. Now, there's something happening in the community. If you go to several of our communities, you put on a face mask, some people look at you as if to say you are fearful, you are afraid. Some people even ask you, is there still COVID-19? Because people that are using face masks in some communities are becoming odd. I don't know if you have experienced that. I have been in a place and every other person there were not wearing a face mask. I found only myself and maybe somebody else using the face mask. I recently attended an introduction to a wedding ceremony for somebody in my family, from somebody very close to me. I mean, everybody there except myself and just one other person were putting on our face mask. And I want to tell us, please, if you find yourself in that kind of situation, don't be discouraged and don't let the majority carry the day, because you see, once we are in the places where majority are not keeping to this protocol, there is every possibility for you to become lax. So we must not allow laxity. A colleague of mine was telling me about, he attended a program in a religious center, and the man that was the leader of that religious center was saying that there is no COVID-19, was thanking God there is no COVID-19 again, and that people can just go about their normal businesses. He, being a healthcare worker, has to raise up his hand and say, excuse me, sir, there's this COVID-19. We should not misguide or mislead the people to do wrong things and lead them into trouble. So the conclusion of this is that we are aware that several people in the community are not observing the protocol. But the few of us who are observing that protocol, we should not be discouraged, but instead we should be icon. we should be people that will let other people know the proper thing, and we should insist to do the proper thing so that others can follow us. Thank you.
Is there anything we can do, with people like that who would not observe protocols, and why we want to stay safe?
Yes, even the state authorities have they have rules, penalties, and for offenders. But how many communities?
All has been relaxed now.
Yes, all these are relaxed now. So you see, that's why government is saying that you are your own. What they mean is that people should take personal responsibility. So what we can just say is that if you are in a place and you know that place is not safe, try as much as possible to separate yourself. Leave the place, or ensure that you do the right thing. That's what we can see for now. Thank you.
Doctor, let me still go back to that. I asked you this question, when we opened with the program. I said people are still burying their dead. And yes, some we just put them in the ground, not knowing the cause of death. Again, a lot could just have been buried with COVID-19. And again, the spread continues.
Yes. So that's why I have said earlier that we need to keep on advocating with our community leaders, our religious leaders. You know that there cannot be any death without a religious leader or the community leader involvement. So we still need people to help us to know that this thing is real, and if there is such a death, the appropriate authorities should be informed, so that if there's a need for what we call COVID barrier, we'll do that. So honestly, the state government and the state ministry of health and the public health stakeholders will need the support of the community leaders and the religious leaders in this matter. Thank you.
Okay, let's get to hear, from listeners out there. What is happening in your area? What are the things you're noticing? And what would you want to bring to the attention of government too, all on COVID-19? It is real. It's a new normal that we are in, and of course the doctor is telling us that we should keep ourselves safe, observe all the protocols that have been put in place, and stay safe for you and all of us. And numbers to call to be part of this program: 081 40989, 081 40989, or 070 87800 989, 070 87800 989. We go for your calls now. Hello, good morning.
Good morning, sir. How are you?
Good morning. Your name and where you're calling from?
Hello. I'm calling from Goningura.
Hello, thank you.
Could I get the name
Hello,
again?
Sir. Yemi calling from Goningura.
All right, Yemi from Goningura. All right, let's hear you.
Yes, sir. Mr. Tony Alabi, I appreciate you so greatly.
Thank you.
That's just the only English I can use for you and your partners there. Somebody like Jerry, Mark, PP, and the rest of you. If we have like 1,000 patients like you in this country, Nigeria will become better. I really enjoyed your visit on this morning, the one that you have spoken with. And I want to put it to you that in this part of the world we belong to, in fact, life is meaningless, right from the head to the bottom. I'm referring to our government now. We don't value life. If we really value life, this is the time you need to support your citizens. At least you are getting something from your citizens. You need to support them. They know how to enforce us to pay for one levy or the other. They're coming to the issue of life now, because when you talk about COVID-19, you are talking about life here. Well, you see, coming to the issue of let's talk about the palliative. Me personally, I'm not doing anything till the inception of this COVID-19 as palliative. Nothing. Not to talk of thousands outside there. You see, hello sir, are you listening to me?
I'm with you, yeah.
You see, my sister had either stone in in the kidney or stone in the gallbladder. When some years ago, she used to go to UK. You understand? Her husband was in there. So when she had this thing, she went to an hospital here. That time they charged him 100K for the operation of that thing. So there was no money. She managed to travel down to UK after some time. You know, the government there, they placed him on appointment and they did the operation for her free of charge. Can you imagine? Somebody that worth 100K here because they value life. Then here we don't value life at all. Hello?
Okay, Yemi, yes, we got you on that.
We don't value life at all. Let me put that across. Let me put that across, Dr. Yefabi. Yes. Dr. Yefabi.
Yes.
You heard him there. You heard him there.
I heard him faintly. It was not very clear.
Okay, please respond to that.
No, I heard him faintly. I just heard him saying that
Yemi is saying that we don't value life here. You know, that government is all concerned about levies, revenues, and of course, you know, getting what it will get from the people. Made an example of his sister who had stones in her and they had to be treated abroad for free. But, you know, with the health sector that is seen to be working. But back home here, 100,000 was asked, you know, to be paid, and of course she had to be flown out. But you know, it was taken care of outside. But back home, we just allow, you know, people that cannot afford it to die. And so, you know, the health systems, so to say.
Thank you, Tatu. You know, we are not discussing the Nigerian health system.
We're not discussing it, but it's tied to what we're discussing, Dr. Ifeanyi.
The issue is that we are aware that the Nigerian health system needs a lot of development, and we cannot compare our health system now with what's obtainable in the developed nation. This is a developing country. We know our challenges. We know that there are a lot of things for us to improve on.
Yeah.
But specifically for the COVID-19, you find out that while we might talk of the weak health system in Nigeria, for now, you agree with me that for the COVID-19 response, some of our states, including Kaduna State, are done beautifully well. If somebody is infected with the COVID-19 in this stage now, right from the time of the person diagnosis, admission, management, follow-up, and any subsequent treatment of such an individual, including the contact tracing, they are completely free. And you will remember that some time ago, they were even analyzing how much a patient with COVID-19 spend averagely in the state. And this is hundreds of thousands per patient. And governments of Kaduna State and other states also who are involved in this, they take responsibility for this.
Okay, we'll say we'll call here, Doctor. We'll move to another call.
Yeah.
Hello, good morning.
Good morning, sir.
Good morning, your name?
Hello?
Good morning.
Yeah, good morning. How are you?
I'm good. Your name?
My name is Musa Balam. My greetings to your crew in the studio. Please, I want to ask the doctor that, well, we agree that Kaduna is doing enough to protect the situation. But for all indication, it seems COVID-19 is reducing gradually. I don't want to call it naturally because it can be natural. It can be due to the effort of humans. That is the health department. But my major concern now is about the apathy or the fatigue being with students. Honestly speaking, we had wanted to see the government have given directives to schools to start putting one or two things in place in anticipation of school reopening. Looking at how other states of the federation have done that. Even within Kaduna State, federal government have given a directive that federal institutions should resume, and they have resumed. I don't know what you people are doing, even though you say you are doing a lot, but at least you taking into consideration time constraints Thank you very much. Good morning.
Okay, thank you. Dr. Ifabi, you got that? You got that?
No, I didn't get that. Please, can you reiterate
Yes, talking about measures, if we have to have our schools opened, all the things that we must put in place, and where government is with all of that now. The federal government unity schools have been reopened, and of course measures have been put in place for them to have the schools reopened. But again, let's Kaduna State, what we have to do if our schools have to be reopened, all of that.
Okay, thank you very much. I think we have said it earlier. Maybe the person just joined us. We mentioned that for the reopening of schools, the state government is working in collaboration with the two ministries, the Ministry of Education and the Ministry of Health. And this is going to be basically on the NCDC guideline for the opening of school. And one of the major items on that guideline is one, that each school must provide provision for hand hygiene, social distancing, proper waste disposal, and schools must bring about innovative way to ensure social distancing and school health for that particular school. For example, if you have large number of students in your school and there are no adequate space to maintain at least 1 meter from the next pupil, there's going to be a kind of reorganization where you can either do morning and afternoon session for that kind of institution. And schools are going to be mandated to have a place either as a school clinic or as a holding area, and there will be a teacher that will be mandated to be in charge of the school health of that particular, a teacher or group of teachers that will manage the school health of that particular school. And also there will be parent teacher association committee members in charge of health, and this will liaise with the school authority. If there is any student who has symptoms, they will bring about guideline where such a student will not come to school, or that kind of student will be immediately referred to the district surveillance and notification official in the local government, and from there the person will get adequate treatment if it's a case of COVID-19 or otherwise. So all this means a lot of planning. That is why you see that in Kaduna State measures are still being put in place as per planning, not just say school should go and reopen. This will happen in a public school and also in private school, and there will be a kind of a monitoring committee who will make sure that what is done in those schools are in compliance with the state and the national guideline.
Okay.
Thank you very much.
All right. Okay, we're still with your calls, and we're still taking your calls on 081 40,989. Hello, good morning.
Good morning.
Good morning.
Good morning.
Mr. Kennedy.
Good morning.
And good morning to your guest, the doctor.
Thank you.
This is Mr. Sam from Malta.
All right, Mr. Sam, let's hear you.
Please, doctor, and I just want to queue behind the last caller. And I know that several other callers will queue after me. Still concerning the school opening, in my observation and thinking as an educationist in the state, I am thinking that those other schools that have reopened, they have better preparation concerning this COVID-19 than Kaduna State. And it is just an appeal to the government that please, it is time for the schools to be reopened.
Okay.
Because we are far ahead in preparation compared to Sokoto, for instance, compared to Kano, and all of these states have resumed. They have reopened. That is my observation this morning.
Okay. All right, Mr. Sam. Dr. Oyefabi, you got that from Mr. Sam?
Okay, I should think it's appealing that the school should be reopened.
Yes.
Yes, it will be reopened, and I'm sure our leaders in the state are hearing you, and they are taking appropriate measures to open the schools. All of us are waiting for schools to reopen. We know our children have stayed for so long at home. I think it's getting close to 6 months now.
Yes, and our parents are getting tired too.
Yes, but at the same time, we need to thank our government because they are concerned about public health. They do just want to open the schools when they are not sure that things are in place. So I can assure Mr. Sam that as much as he is boarding the school reopening, so are the leaders in this state also concerned.
Okay, let's also squeeze in this call.
Who will be reopened.
Okay, all right. We just can squeeze in one or two calls before we bring it to a close. Hello, good morning.
Good morning, sir.
Good morning.
We have been hearing rumor that school is open January. So I don't know how true it is.
That what?
Because I see that we and other schools that have started, we do the same junior YS, and our stream of work, we are going to lag behind. Thank you.
Okay. Okay. Rumor about having schools open in January. That's what last caller just said. Well, we're not going with the rumor mill here. Government will announce when at the appropriate time. I'm sure. Okay.
Let's just change and just wait. The government is trying to put things in place.
Okay.
For our good and for the good of our children. Let's forget about rumor, please.
Okay. This will be my last call. Our last caller. Hello. Good morning.
Good morning.
Yes.
Good morning.
Hello, good morning.
Good morning.
This is Adeni from Naya Kabbalah.
Adeni, right?
Yes, from Naya Kabbalah.
All right. Let's hear you.
Please, actually talking about the COVID-19 and the reopening of schools, especially in Kaduna State. I'm a private school teacher, and sincerely, I have children, no work, no money, no food. Please, the Kaduna State government is putting the people in darkness. Let me explain my point. We don't know the time when the school is going to reopen. Nothing is being communicated to the people. The only thing we hear is school is going to reopen soon. Please, we need an adequate date of when the school is going to reopen.
Okay.
I don't know if something can be done concerning that, because people are so anxious to reopen. Sincerely, there is no money and people are being starving.
All right.
So thank you very much.
We got you on that. Dr. Ifabi, the callers are saying have our schools reopened, the schools to be reopened. The economic crunch on parents and households is really showing. But again, I'm sure that your response will be on government, still with government. So what are you saying here?
I didn't get it very clearly. What is the specific request? I didn't get it clearly.
The request is we want our schools to be reopened now.
Sure, that will be done. Sure, that will be done. As I've said, our leaders in the state are also on the program, and they are listening and they are making plans, and school will be reopened.
Okay, and that will just be about the size of it on the program perspectives this morning, where we looked at COVID-19 and how it's taking its toll on government and the people. And of course, to you all out there, government is not sitting on its oars. It's doing something to get us all back, to live their normal life. And Dr. Ifabi Adegboyega Moses, a consultant public health physician with Berao Diko Teaching Hospital, Kaduna here, and a senior lecturer, Kaduna State University, has been our guest by phone this morning. Dr. Ifabi, thanks for being with us this morning.
Thank you, Mr. Tonyalabi, for having me.
Okay, we'll come back with Perspective tomorrow. Same time, same station. I'd like to thank our intern in the house, Maranatha Olanriwaju, and of course, Dorcas Bagaya, for connecting us with the people. Good morning.
Good morning. Thank you.